Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
Good morning, Chicago. My name is Dr. Ige. I am the Health Commissioner for the City of Chicago, and I have here with me colleagues, and I'll let them introduce themselves.
Hi there, I'm Dr. Michelle Funk. I'm the Medical Director for Community Congregate Settings and Disease Control Bureau, and currently I'm the Acting Incident Commander for Chicago's New Arrivals Response within the Health Department.
Yeah, and I'm Dr. Alex Sloboda. I'm the Medical Director of Immunizations or Vaccinations, as well as Emergency Preparedness.
Well, welcome. We're here today to provide information. We had the first case of measles in the city of Chicago since 2019. That is important. Measles is a serious illness, and so we're here to provide information to all Chicagoans on what is going on, how you can protect yourself, and all of those important things you need to know in an emergency. So we are going to start by just telling you what is measles. And Dr. Sloboda, do you want to explain to Chicagoans what is measles? What are the symptoms? What should people be looking out for?
Sure. So measles is a virus. It is one of the most highly contagious viruses that we know of. It's airborne, so it's spread through the air, and it can stay around for quite a long time. It can stay in the air for up to 2 hours, so that's why it's so contagious, because it hangs around for a while. And it can lead to severe complications. The most basic symptoms, usually you have a high fever, you may have red eyes, a lot of runny nose, watery eyes, and cough. And then after that, you have the fever, and then you get this rash that starts on your face and kind of just goes down your body, as you can see in the picture right there.
So parents, if your child develops a high fever and a cough, and a runny nose, and then red eyes, even before they develop a rash, please let your providers know. The rash is this very fine kind of rash. It starts from the face and then spreads to the rest of the body. So we don't want you to ignore it. Don't think it's just any other rash. At the moment, we want you to check in with your providers to be sure if it's measles or not. Now, how does measles spread? Dr. Sloboda, you mentioned that it is airborne, it is contagious. Dr. Funk, do you want to say a little more about how measles is spread?
Sure. So measles is very contagious, and it spreads through the air when an infected person coughs or sneezes. Something that's really important to know is that it really targets those people who are not immune, and those people can catch it, within about 2 hours after the person who was infected has left. Infected people can spread measles to others about 4 days before they have the rash and about 4 days after the rash appears. And the really important thing to know is those who are at risk are those who have not had their measles, mumps, and rubella vaccine, which is a very common vaccination that is provided during childhood, during pediatric visits.
So generally, among Chicagoans, most people will be vaccinated. Vaccination happens between 12 months and 15 months for the first vaccine, and then preschool between the age of 4 and 6 years old. So for most children or for most adults, since 1971, MMR has been a part of the routine vaccination for residents. So if you have not had those vaccines, we will tell you in a bit how you can verify. But if you're vaccinated, you are immune. If you are not vaccinated, you are not immune, and so you need to take some precautions. Now, most people want to know, am I at risk of getting measles? And if I am, how can I protect myself? I will pass this on to Dr. Sloboda again. If you are a Chicago resident, hearing this message today that there is measles in the city, what do you need to do? How can you protect yourself?
The best way to protect yourself is with the vaccine. So very thankfully, we have the MMR vaccine that's been available for decades that is very effective and very safe in protecting us from measles. And so if you've received those 2 doses, as Dr. Ige said, as a child, you are very safe and you should have very little to worry about. Yes.
Well, again, vaccination is the key here. That is the best prevention and protection against measles. So if you are not sure that you have been vaccinated, please stay on so you can hear how you can verify. But if you have been vaccinated, again, you should be confident that you're protected against measles. Mm-hmm. Now, but there are some people that cannot be vaccinated. Dr. Funk, who are those people?
Yeah, so it's important to know that some individuals, including those who are pregnant, as well as children under the age of 1, should not be vaccinated against measles. There are a couple of exceptions to that second bullet point. In some particular circumstances, we can vaccinate those who are 6 months to 1 year of age. However, that vaccine doesn't build quite the good memory that would be built if we had someone who is vaccinated over the age of 1 year. And so this is a decision that can be made in collaboration with the health department and in some cases your pediatric provider.
So pregnant people, if you have children under the age of 1, we want you to be particularly cautious about being exposed to measles. If you do become exposed, please contact your health provider immediately so they can take appropriate steps to protect you. We've been talking about vaccines. The MMR vaccine particularly. Where can people get these vaccines? We have some options. The Chicago Department of Public Health has vaccination clinics. But we don't want you to just come to Chicago Department of Public Health Clinic if that's not convenient for you. There are also MMR vaccines at most doctors' offices, so you can go to your regular provider to be vaccinated. You can go to neighborhood pharmacies for vaccination as well. We want this to be within the reach of all Chicagoans, so if you're not vaccinated, any of those options are good. For those who have young children, even in those who are as young as 10 years old, they can get vaccinated at pharmacies under the Illinois law. So you don't have to wait to go see a pediatrician or schedule an appointment with a pediatrician to get your children 10 years and older vaccinated. Immunization clinics, our immunization clinics, when I say our, that's immunization clinics run by the Chicago Department of Public Health, provide vaccines at no cost, no out-of-pocket cost to anyone 0 to 18 years, and then those who are uninsured adults are 19 years and older. So cost is not a barrier. Insurance is not a barrier. And there are some options here that we will share with you. The Greater Lawn Immunization Clinic, Uptown Clinic, Lower West Clinics, these are all places where you can get vaccines at no cost, even if you do not have insurance. Now, there are some people who are not sure if they're vaccinated or not. Dr. Sloboda, how can someone verify their vaccination status?
Well, thankfully here in the state of Illinois, we have a program called iCare, where all the vaccines that are given in the state of Illinois go into a database so they can be tracked between providers to make sure you have all the vaccines that you need to be protected. There is, as you can see on the screen, there's an address where you can go to Vax Verify, where you can also check your own records to see what vaccines you have received and make sure you've received the appropriate MMR vaccine, which covers for measles.
So Vax Verify, check in there. You will see if you've been vaccinated or not. If you're still not sure, you can talk to your provider to get other guidance. What should I do if myself or my child has been exposed to measles. Dr. Funk, do you want to help us there?
Sure. So the first thing that's really important to know, again, is whether your child has been vaccinated. So if your child has been vaccinated or you have been vaccinated, you are very well protected against measles. There's about 93% protection for a single dose and about 97% protection for 2 doses of measles vaccine. And so the important thing to do is first check, as Dr. Sloboda has mentioned, with the Vax Verify. In addition, if you as an adult do not have access to those vaccine records, you can check with your healthcare provider. In addition, if you've been going to school in the United States, oftentimes you can verify those records with your university or with your school system that you went to as a child. So these are some alternative locations. If you have been vaccinated and you can verify that after your exposure, then for the most part, you are safe and you are good to go. In the event that you are not vaccinated, then there may be some additional measures that are needed to stay in your home and stay in place. And typically that will be a decision that's made in collaboration with the health department.
Right. So again, if you are exposed, not immune, that means you have not been vaccinated, please stay at home, call your provider, and let your provider give you instructions on what next to do. If you've been exposed, please stay at home and get in touch with your provider for next steps. This is important to prevent the spread of measles to other non-immune populations. So, measles is in Chicago, but measles is also popping up in other places across the United States. There are now 17 states that have had measles pop up. And that is because vaccination coverage has been lower than before. So again, our key message here is if you are not vaccinated, please get vaccinated. This is the way to stop the spread of measles in our city. This is the similar measure that is going on in other states where measles has been detected. So what are we doing to contain the spread of measles in the city of Chicago? We have had measles in the community at large, and we have also had measles within our new arrival shelter. And we have been working hard to contain the spread of measles in this setting. So I will let Dr. Funk, who has been our incident commander, supporting the health of the new arrivals, to tell us what the status is there for our activities.
Sure. So, as Dr. Ige mentioned, this is kind of an unfortunate circumstance in which the nation is dealing with a large measles outbreak, and this coincided with many new people who just need to have additional medical support. Within this situation, we have currently 7 shelter residents in Pilsen, 4 children and 3 adults. We currently have been working with partners to vaccinate nearly 900 eligible shelter residents. And this team, Dr. Sloboda, did a lot of work this weekend to do this, to reach greater than 95% coverage, which is really necessary in order to have that full immunity to protect those in the shelter. In addition, newly vaccinated persons will be considered at immune post their vaccination timeframe. And then in addition, just for everyone's awareness, there's one case that was not associated with the shelter that actually was identified as prior to these cases. CDPH investigates every case to identify those who might have been exposed and follow up for 21 days to monitor to see if they develop symptoms. So this is a very robust response. It's happening at the shelter, it's happening at the community, and we perform evaluation investigation for both.
Yes, so you mentioned that Dr. Sloboda and a team of our providers and vaccination teams worked all weekend to ensure that everyone eligible for vaccination got vaccinated. Dr. Sloboda, would you tell us a little about how that was set up, the steps you took, and how we were able to get to this impressive number of reaching everyone that was eligible for vaccines at the shelter?
Sure. So once we were made aware Thursday evening about this case in the shelter, we acted very quickly and mobilized every resource we had available, and we had a lot of help from different partners within the city and within the community to act swiftly in order to protect everybody in the shelter. And so we started there Thursday night, and throughout Friday, Saturday, and Sunday, we worked 12 to 16-hour shifts in the shelter to get everybody vaccinated who we could not verify that they had been vaccinated before. We evaluated people to make sure that it was okay for them to be vaccinated. And we also verified people that had records, either with the state, Cook County, or from their home country, that proved that they had good immunity over the weekend. So I'd just like to thank all of our partners, for healthcare providers, staff, shelter staff, community-based organizations that stepped up and helped us complete really an unprecedented operation over the weekend that's not really been performed anywhere else in this similar circumstance. So, yeah.
I just want to say a big thank you to you, Dr. Sloboda, and the rest of the partners and CDPH team that worked all night until 2 a.m. on most days, just making sure that our shelter residents are protected. So one of the pieces here is for those who are not immune and they got vaccinated, they are still going to require 21 days before the vaccine fully kicks in. So what are we doing there to ensure that people are protected even after they are vaccinated?
Sure. So what we're doing, like Dr. Ige said, it takes 21 days for that first dose of the vaccine to kick in and be fully protected. So we are having people quarantine to protect themselves and the people around them so that we can control this measles situation and make sure it doesn't spread to others and cause others harm, and also closely monitor them to make sure they're safe, and if they need any medical care, we'll provide it immediately and make sure they get the proper treatment.
And in addition, we have been working with state partners to move those who are most at risk of developing, if they develop measles, to become very, very sick. So in other words, those with very young children, families with pregnant individuals, to a special space that they can stay and be separated from the rest of the people at this facility.
Well, thank you, Dr. Funk, and thank you, Dr. Sloboda. I know there are many, many questions in the heart of Chicagoans about this outbreak that we're dealing with, and we're here to answer some of those questions. Are we beginning to see questions from folks? Are there other areas of clarification? So we are seeing some questions here. Anna from Facebook says, where are all the pregnant people and babies living at Halstead Shelter going while they isolate, haven't been exposed? Does Chicago have sufficient vaccine on hand for pediatric patients and adult patients? Dr. Funk, do you want to take that?
Sure. So I'll answer the first part of that question. So we, like I mentioned, we've been working closely with state and state Department of Public Health, also State Department of Human Services, as well as DFSS, to identify a space where people who are the highest risk can quarantine if they were exposed. At that site, there will be, just as there is in the Halstead shelter, daily monitoring for symptoms and connection to care if there is someone who develops symptoms. In addition, with regards to vaccine, we've leveraged many healthcare providers and partners, as Dr. Sloboda has mentioned, to support and provide vaccination. In addition, we've leveraged some support from state and federal partners on this behalf as well.
Yeah. In terms of sufficient vaccine on hand, yes, we do. We get, CDPH gets vaccines normally from the CDC, and we always get sufficient supply. And in this situation, we're every day ordering more. So we will definitely have sufficient supply on hand to vaccinate anybody that needs to be vaccinated.
Now, cost is a concern. So I see here a question from JD on Facebook. Is there a cost for the MMR vaccine? For those who have insurance, their insurance will cover it. And for those who do not, we have options available. The CDPH clinics provide vaccinations at no cost, no out of pocket for children. And for those who don't have insurance, you can still come to us and we'll be able to give you your shot at no cost. Why was there such reluctance to vaccines from the city over the summer when the police stations were begging for them? Reluctance to vaccines from the city. Well, I am going to interpret that in two ways. When people are arriving, the first need that they have is for shelter and food and clothing. So that's the first order of the day to get them those things. There is also an urgent need to identify those who may have healthcare, urgent, emergent healthcare needs. So that is taken into consideration. So those were the initial things that we did. Everyone arriving, vetting to make sure if they had any urgent health need, they could get into an ambulance quickly and get connected to services. Now, as the operations evolved and we transitioned people from that unstable context of police stations into a more stable context of the shelter, we're able to provide more comprehensive medical screening. And that is done in partnership with Cook County Health, where people have appointments every day to do this comprehensive medical screening. Think of it as similar to your annual physical. So it is a thorough medical examination at which point people will also get vaccinated if they are not up to date on their vaccines. And so that is done for new arrivals as they come. As you can imagine, we had thousands of people coming. So according to the CDC guidance, we have up to 90 days to ensure that this medical examination is done for those who are refugees in the United States. And to the best of my knowledge, we have been working very hard to ensure that that is the case, that all new arrivals who are coming into our shelter system have that opportunity for comprehensive medical screening. But even if they are not yet scheduled for the comprehensive medical screening, if there are any urgent medical needs at any time, we have protocols in place for anyone to be able to call 911 and get immediately to care when they need it. In addition to that, we have vaccination activities on site at every shelter at least once a week. This is an additional layer of support to ensure that vaccines are always available. Now, as you know, there is a lot of education that is necessary for people to understand what is going on. Why am I being offered a vaccine? Why is this vaccine different from another vaccine? I got some vaccines in my home country. How is this different? So there's a lot of education that is required to help people know COVID vaccine, flu vaccine, varicella vaccine, MMR vaccines. There are a lot of vaccines, and people just need some time to understand which is which and why. And we provide that opportunity for people to be engaged and educated so they understand what is going on. And one of the success stories here, especially for the measles response, is that of all those who were eligible that were offered vaccines, we had no refusals. And I think that that is important to note. Once we provide people information and opportunity to ask questions and respond to those questions, most people are willing to accept the vaccines. Vaccines are also provided at the landing zone as people arrive in the city. Again, there we have not had refusals of vaccines. So with some education and explanation of what these vaccines are and what they do, we have had very high acceptance rates. Do arrivals have to meet state and CPS vaccination requirements to go to school? Dr. Funk.
Yeah, so with regards to new arrivals, they are considered to be, in this circumstance, unstably housed. And as a result, they are allowed to have an exemption through something called McKinney-Vento, which is an exemption. The goal here is to really balance the needs for students to be able to have the community and otherwise mental health and educational support that is provided by schools while they are in the process of getting connected to a healthcare provider and to be able to receive those vaccines. So in other words, there is constantly a push and support to be able to get students connected to vaccines, but we also are working, closely to ensure that that students are able to be enrolled in school and have those benefits of school.
Thank you, Dr. Funk. So we want people to be enrolled in school, and we want to give them the opportunity to settle in while also simultaneously assessing their vaccination needs and then connecting them to those needs, to meet those needs. So Sarah on Facebook says, I've had measles pre-1960 and was vaccinated when it came out around 1960. Does this mean I'm immune? Yes, that means you're immune. Lydia on Facebook also says, as the city or state started medical screenings at the landing zone, last I checked approximately 2 weeks ago, they had not started at that time. I will give a quick overview again. When we say screenings, we provide screenings at the landing zone for symptoms and any other signs of urgent medical needs. A comprehensive medical screening cannot happen at the landing zone because it requires drawing blood, it requires doing x-rays, it requires doing other kinds of tests, and that is scheduled for when people arrive at the shelter and have the opportunity to go through a comprehensive medical examination. And we do that in partnership with Cook County Health. Why did you bring in the CDC? Yes. So the Centers for Disease Control is supporting the response to measles across the United States. There's 17 different states that have measles outbreaks at the moment. In such instances, there is support from the CDC to help bolster the capacity of those states to respond. As you can imagine, in an emergency, we have pulled all of our medical directors. We had to pull all of our staff to ensure that we can keep up with containment measures. So that additional reinforcement, we have some additional medical folks who have come from CDC and other epidemiologists who are coming to increase our capacity. And that's been a very welcome addition. They're also providing technical guidance where needed. Again, this is an unprecedented situation because there are no other context where we have so many thousands of new arrivals, and we need to protect them from measles because measles is circulating in the United States. They came here without measles, and now they are being exposed to measles, and we have to do everything we can to protect them. So that is an urgent priority right now to protect those who are newly arrived in our city from this virus that is circulating in our city. Robert on Facebook, this is Merida. What is the plan for getting the remaining new arrivals at Halstead and other shelters vaccinated? Oh, there's good news there. Everyone who's eligible for vaccination at Halstead has now been vaccinated. We are very proud of that achievement, and thank you to all the teams at CDPH who worked nonstop to make that happen. Robert on Facebook says, what are we doing about all the people hanging around outside and in the neighborhoods around the South Halstead shelter? Now, this shelter is home to about 1,900 people. Of those, about 999 are vaccinated and immune. The remaining half of the shelter have just been recently vaccinated and are expected to isolate and quarantine for the next 21 days. So they have cards. Those who are immune have a card to say, I'm immune and I can go in and out. Those who are not immune have cards to say quarantine, and they are quarantining at the shelter for the next 21 days. So that's the plan. If I am vaccinated but have direct contact with someone who has measles, can my unvaccinated 3-month-old baby get measles? Now, if your 3-month-old baby was with you during that exposure, then yes, they will be considered at risk and you need to contact your health provider right away. You, though, if you're already vaccinated, you will not be at risk. So, but if your 3-month-old was not with you during that exposure, your 3-month-old will be safe. So please check in with your provider to see what the appropriate guidance will be for you. Did you give immunoglobulin to infants under 6 months and pregnant women and HIV and other immunocompromised patients who did not have proof of being vaccinated? So this is Howard on Facebook. Alex, do you want to take that question?
Sure. We are working on that right now. During the process over the weekend, we identified all these people that were at risk, 6 months and under, and pregnant people, and those that are immunocompromised, to swiftly get them to a safe place where they wouldn't have any further exposure. And our teams at CDPH are working on starting that process to get them extra protection if they need it as well.
Yes, immunoglobulin infusions are infusions and need to be set up in an appropriate context. So moving them out was the first step, and then making sure they get the immunoglobulin as quickly as possible is the next step. For those that have been in healthcare settings, they are already getting that. CDPA does not have a stock of immunoglobulin, so it is ensuring that the appropriate health providers who can are connected and are able to support the high-risk people. Abel on Facebook, is it possible for measles to mutate and become a risk to people already vaccinated, like those of us vaccinated as children? There's good news there. To date, we haven't seen that happen. Measles is one of the diseases that is even was close to eradication or elimination in many populations because of how effective the vaccines are at stopping infection. So we have good news there. It's not a disease that has shown a lot of complexity. If you're vaccinated, you're mostly safe, and we have seen transmission stop in many places where there's high vaccination coverage, and we hope that we can get back there, get all Chicagoans vaccinated who are not, so that we can stop the spread of measles. Scott on Twitter, should we start wearing masks to protect ourselves? Dr. Sloboda, do you want to take that?
Sure. Like we've said, the best protection and the protection that you need is the vaccination. So if you receive the vaccination in terms of measles, you are properly protected and you're good to go. In terms of wearing a mask to protect yourself, there's nothing wrong with some extra protection. So if that makes you feel comfortable in the situation, I think that would be appropriate.
Yes. Again, we want to reiterate, we do not want people to depend on wearing a mask to protect themselves from measles. The best protection from measles is vaccination. And this is because measles is airborne. So we want people to know masks are good. They protect from many other viruses, COVID, flu, RSV, those are still about. So if you're at high risk, wear your mask. However, for measles, we want to reiterate vaccination is the most important thing to do to protect yourself. Yes. So Paola on Facebook, can you provide more info on contact tracing effort and how it will be shared out and communicated with the general public to prevent further transmission? Yes. Dr. Funk, you want to talk a little about contact tracing and how we do that?
Sure. So measles is one of those unique diseases in which anyone who is not immune, who is in the same space within the 2 hours after somebody who is infected is in that space, would be potentially at risk. And so the steps that are included are first identifying those who are in a potential space that are not immune based on our vaccine history records. As Dr. Sloboda mentioned, we have that Illinois registry. In addition, we continue to monitor those people. So throughout the time frame that they could potentially develop the virus, measles, we continue to check daily to see if they have any symptoms. And if they do have symptoms, they're given a directive to go to a healthcare provider, which again is the healthcare provider that is knowledgeable about how to handle measles. And so by doing this, we can identify if there's anyone that would need additional support or treatment.
Yes. So Carrie on Facebook, how are we protecting infants? I know parents are very concerned right now, especially if you have an infant that is not old enough to be vaccinated. The best protection for everyone right now is to get vaccinated, especially for the sake of the little ones who are not able to get vaccinated just yet. So parents, siblings, anyone around the children should be vaccinated as the best way to protect them right now. So if you have children under the age of 1, they cannot be vaccinated. So the best way to protect them is to be vaccinated yourself and to ensure that all those who are around them are vaccinated. It is important to, again, emphasize that measles did not come with the new arrivals. Measles was already here, and those who got infected because measles was circulating in Chicago. So we haven't seen cases of new arrivals coming with measles. Measles cases were acquired here. And so we have been working very hard, taking our responsibility to safeguard the health of new arrivals seriously. So we have been working to make sure anyone in our shelters who might be at risk of contracting measles is vaccinated as quickly as possible to protect them from this virus that is circulating in our city. What measures can other shelters take to prevent measles and other outbreaks such as chickenpox? Vaccination, vaccination, vaccination. For everybody in the city, whether you're a new arrival or not, vaccine-preventable diseases can be prevented by getting vaccinated. For those who have been in transition or unstably housed, they may not have had the opportunity to get vaccinated because they have been in transition. So we are prioritizing them to get vaccinated. But we have thousands of residents in Chicago who have not been in transition, who are not vaccinated. And so we want to urge all Chicagoans, if you have not been vaccinated for varicella, for flu, for COVID, for measles, please do so now. Vaccine-preventable diseases mean that these diseases can be prevented with vaccines. So vaccines, vaccines, vaccines. I will keep saying that today because that is the key message here. Can people with measles be asymptomatic? Dr. Sloboda, do you want to?
Usually when you have measles, like we talked about at the beginning, you have those symptoms where you have the cough, the runny nose, the watery eyes, the red eyes, develop the fever, and then it goes into the rash. So 4 days before the rash appears and 4 days after the rash is when people are contagious and can spread measles. But if you have no symptoms, you're not going to be spreading measles.
Thank you. To my understanding, the Holster shelter has already been vaccinated and is currently under a 21-day quarantine. Is that correct? Yes, that is correct. Everyone who had not been vaccinated has been vaccinated. And because it takes 21 days for the vaccine to be fully protective, they are in quarantine for the next 21 days. We have one more question. Can measles spread on surfaces or just in the air?
So for the most part, the airborne transmission is the most important way that measles can spread. And so again, measles can last in the air for about 2 hours after the infected person was present, while surfaces are, surfaces are not a primary method of transmission. And just if it makes you feel comfortable, just using routine measures to clean surfaces is appropriate. But really, it's the air that we need to keep clean.
Yes. And remember, if you're vaccinated, you don't need to worry. If you're vaccinated, you don't need to worry. If you're not vaccinated, you need to take action and get vaccinated. What should folks call? Who should folks call if they don't have a provider? If you need to be vaccinated, please check any of our 3 clinics. Vaccination is free there at no cost, no out-of-pocket cost. For those who are under the age of 18, if you're older than 18 and you do not have insurance, we will also be able to provide vaccination for you free. Can I only get my vaccine at the doctor's office? You can get it at the doctor's office. You can get it at the pharmacy. You can get it at our clinics. There are vaccines available in multiple places. So if you have a neighborhood clinic, a neighborhood pharmacy, you can check there as well. Can I say get measles even if I have received 2 doses of the vaccine? The vaccine is very effective, 97% effective. Yes, it is not 100%. There are still a few people who might develop symptoms, but very, very few. And usually the symptoms are mild. But, 97% is as good as it gets, for vaccines. So it's pretty good. Do I need to get a booster if I receive the measles vaccine as a child? Oh, no, you do not. This is one of those really good vaccines. You get your 2 shots, you're fine. You're good to go. So no need for boosters here. All right, Chicagoans, we know you will continue to have questions. We will put out press releases to keep you updated as we see new cases. But we wanted you to have this information so you know how to protect yourself and your families. And we are doing everything we can to contain the spread of this infection. And I'm very grateful to our colleagues, our partners who have worked with us to mobilize all resources to get people vaccinated as quickly as we can at the shelters and beyond. So we encourage you, again, vaccination is the best protection against measles here. So please schedule your vaccination appointment if you've not been vaccinated, and keep safe, everyone.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.